Good morning, Peter Goertz. I'm a psychiatrist. Risk of being assaulted as a psychiatrist. What brought this issue up for me was recently I saw a resident sitting in an office. I walked into the office. The resident was sitting on the far side of the office from the door. Very small office. And then there was a desk, and on the other side of the desk, so closer to the door, right next to the door, the patient was sitting. And I thought, wow, that really does not seem like the best way regarding safety to see a patient, because the resident he was already cornered. I mean, luckily the patient was not agitated, but that was a situation where the resident was automatically cornered, basically. So that can be an issue or definitely is an issue worth looking at. Maybe the most important thing to consider when you are thinking about potentially being assaulted as a patient is to try and make sure your relationship with your patients, and with any patients that are around, if you're on a ward, for instance, is good. You want to genuinely have the best interests of the patients in mind. You want to be courteous, kind, respectful, have a sense of humor, and have your emotions really, or your actions and emotions really come from your heart, and the patients can feel that. Now, having said that, you can say, this guy, what is he talking about? This is not easy. How are you going to have a relationship, let's say, with a psychotic patient who has a history of traumatic brain injury? How are you going to have a good relationship with that patient? And of course, things can be very difficult. Another important issue is your relationship with staff members. Again, you want to be respectful. Any staff member, housekeeping, the housekeeping person might come to your aid if there's a fight, for instance, or if a patient assaults you. And nurses, any staff member you want to have the best possible relationship with, and that can really help you in an emergency situation. Minor things can really help you to have good relationships with your patients, and they don't take a lot of effort. Let's say a patient on a psychiatric ward reports a physical complaint. Just take a minute, listen to his heart, or examine their throat, whatever the issue is. If someone is asking for a nicotine patch, you may want to consider giving that. And if someone's asking for double portions, let's say they've been homeless, haven't been eating much, consider that. Ensure, same issue. If someone wants an extra blanket, consider giving them that. And those little actions, in my experience and my opinion, can really help you to have good relationships with your patients. If they want a glass of water while they're talking with you, give them a glass of water. If you're working on an inpatient ward, talk to your patients regularly. That, of course, helps. Don't minimize the time to a point where it's really very little time you're spending with the patients. And like I mentioned initially, you want to really be mindful of the way your office is set up. So if at all possible, you want to sit closer to the door. You want to minimize objects in your office that could be used as weapons. There was a psychiatrist I worked with who stopped wearing ties, and he'd been grabbed by the tie by a patient. So see what works for you. These things are worth considering. I do wear a tie, knock on wood, I have not been grabbed by that tie. If there's a button you can use, some facilities have buttons. Someone can press a button without a noise, without a sound going off, so the patient may not notice it. And unfortunately, though, things can take time. So when I worked on inpatient wards, it was a large hospital, large city hospital, and the wards were on different floors. So if someone called for help, men from different floors would, as quickly as possible, come to our floor, but that could take up to maybe 5 minutes or so. So a lot of things could happen in 5 minutes, unfortunately. If there's a messaging system, so if you have instant messages, that system available at your workplace, you could use that. That can work pretty quickly. Message a nurse or a colleague. I remember once I was sitting in an office, and this was when I worked at the VA, and the psychiatrist in the neighboring office messaged me something about, I think it was a patient getting agitated. So that worked out pretty well, and that was a relatively quick way of that psychiatrist getting help. You want to be aware, be in the moment as much as possible, be aware of your surroundings, also be as in touch as possible, be aware of your own emotions. Psychiatrist I used to work with, an older psychiatrist who'd been working in that hospital for many decades, and he had only been assaulted. He said, "Peter, I've only been assaulted twice, and each time was when I lost my own temper." So we want to really be careful, be as in touch as possible with our own emotions so that we don't trigger patients potentially. We really don't want to do that. Any emotion is worth being in touch with, of course. And one emotion that, as an example, I want to mention my own experience with was fear. You want to respect fear. You want to trust your instincts. And the fear issue came up with me with a patient, a very psychotic patient. I think the day before, he was in the dining area, just bending over backwards in a bizarre fashion. And I remember another patient told me, "Doc, he's having a seizure. Do something." So the next day, that patient, while I was in his room talking with him, said, "Shake my hand." Unfortunately, though, I was fearful. My instinct was not to do it, but I did it because he was quite insistent. But that was a mistake, and the patient would not let go of my hand. Fortunately for me, though, it seemed like he was ambivalent about potentially assaulting me, so ultimately he let go of my hand, and I was able to leave the room without any major incident. So that was a wake-up call, though, for me. You definitely want to trust your instincts. If your instincts tell you, get out of that room, no matter what's going on, you want to really do your best to get out of that room. You can just say something potentially simple like, "I need to step out," and just leave the room. Large male staff in the past, when I worked on inpatient wards, were very helpful. Of course, you want to maintain as good a relationship as possible with those large male staff members. And if necessary, like I said, I had that incident where the patient, when I was in his room, just would not let go of my hand. If necessary, I found it very useful to just talk with patients in hallways. Of course, privacy can be an issue, but if you talk with a patient in a hallway rather than in the patient's room or in your own office, that can really help you to be closer to other staff members or patients that might help you. And again, privacy potentially can be an issue, so you want to, even in the hallway, it's possible to have enough privacy often. If you step away from other people, at least a certain distance. In my experience, patients have been very helpful in helping out with emergencies on the ward. Once I was about to walk around a corner, and all of a sudden I see a patient running towards that corner, and I wasn't aware of it, but what had happened was there was a patient standing behind that corner about to whack me over the head with a broomstick, and the other patient was running to fight. She had her fists up, a female patient running to fight that other female patient who was intending to whack me with a broomstick. So patients can be enormously helpful, and it's touching. It's really, our humanity, whether we're patients or staff, is the same, and that type of situation definitely can sometimes bring out the best in patients and staff. I remember another patient, a psychotic patient, sitting by himself most of the day, seemed to be maybe internally preoccupied, but once there were two other male patients fighting, and the patient just jumped up and got in between them, broke up the fight. So even if someone is psychotic, they definitely can snap out of it and really be helpful. Thank you.